Yeah, that worked.
Okay. All righty. Mr. Hartzell, are we ready to start?
Rock and roll, Dr. Lisa.
All right. Excellent. So this is our weekly COVID update. The numbers in Colorado are improving. We didn't see such a big surge over the Christmas holiday as we were, anticipating. Of course, there's still time, but the overall numbers in Colorado are much better this week than we saw, the surge that happened here after Thanksgiving. Positivity rate also, there's a little blip here from the holiday travels, but again, not as severe as other parts of the country that we've seen. So again, good news for Colorado. Our incident rate continues to be very robust. Unfortunately, there are very high incidences of COVID throughout our state, and so community spread is obviously still a thing. Hospitalization rates have also relaxed a bit, which is great news for everyone. Specifically here at St. Vincent's, when we have critically ill patients, there are beds now for them on the Front Range, which was not the case at the end of last year. So that is also good news. And then deaths in Colorado obviously mirror the cases. And so we had an enormous surge of deaths here after Thanksgiving, but things have tapered down a bit. Of course, as everyone remembers, it does take 2 weeks typically after infection for people to realize the death rate after that. And so hopefully it continues to trend downward, but the good news in Colorado is good. Our Lake County data mirrors the state again. We have had, our cluster of cases here, but if you look at the overall numbers, we're not seeing as many positive cases as we were after and during the Thanksgiving holiday. So it's good news for Lake County also. Our positivity rate, we have that same little blip, and I'll show you the specific numbers, but you can see that it is not as high as it was initially, but it continues to trend upward. Overall cases, very steep in the amount of people that are becoming infected here in Lake County. Hospitalizations, we've had our cluster of hospitalizations as well. The darker the number here, the more compressed the data is. And so if you can just sort of look, we went for months without any COVID admissions, but now, of course, here at the end of 2020, the beginning of 2021, we've had nearly at least one COVID positive patient here per day. The numbers themselves, over the past 2 weeks, we've had 40 positive cases, which gives us a positivity rate of 18%. The state of Colorado is less at 7.6%. So that means the number of people that are coming in to get their tests, and over the past 2 weeks, both at St. Vincent's and at Rocky Mountain Family Practice, 219 people wanted to be tested, and 40 of them were positive. So definitely not out of the woods yet, for sure, but the trend is not as severe as we had initially anticipated when we saw what happened over Thanksgiving. So the message, still the same: continue to wear your masks, stay out of groups, wash your hands, and with our ability to vaccinate people now, hopefully things will continue down the same path. As far as vaccinations go, the public health department has done a fantastic job. Almost all of tier 1A is done. There's a couple stragglers, but they will be finished this week. And then we start the second round of vaccinations, which will happen after the 21st, I believe, is the first round of those. And so we'll have tier 1A done here by the end of January. And then as long as our vaccine shipments continue to arrive, we'll start with the 70 plus crowd here as soon as we can, and maybe even as early as the beginning of February. We will definitely keep you all posted. The public health department, of course, has been credentialed to provide COVID vaccinations. St. Vincent's received their credentialing today. Hopefully, Rocky Mountain Family Practice won't be far behind, but it definitely will not be a secret when the vaccines will be available for the 70 plus crowd. And we're meeting today about how we're going to try and roll that out. If we estimate there's probably about 1,000 70 plus folks here. And I think what we're going to do, and again, we haven't made a final decision, but we'll rank people by age. And so the older folks will get their vaccinations first, and then going down until we can get everyone over 70 done during the month of February. But it's good news. And as long as we continue to receive shipments from the state vaccine, we should not have any reason not to be able to accomplish that.